What is diabetes? When you talk about diabetes, it's a lifelong disease that is usually marked by high levels of sugar in blood. The causes of diabetes is either because there is too little of insulin or resistant to insulin or combinations of both conditions. And insulin is an hormone or a chemical substance that is produced by an organ in our body called the pancreas. It is responsible to regulate the blood sugar. So it does this by facilitating the movement of sugar from the bloodstream into the tissue where it is converted to energy so that it can be used to do our daily activities. In people with diabetes, it's either because their pancreas is not producing enough insulin or their fats, liver or muscle cells are not responding to the actions of insulin normally or combination of the two. Worldwide, it is projected that by 2030, about 360 million people will become diabetic. Gambia is not exception. Both diabetes 1 and 2 are increasing. However, diabetes 2 is increasing more than diabetes 1. Because of the increase in the obese, more people are becoming obesity, and there is also a decrease in the activities levels of the people as nations are becoming industrialized. So in the Gambia, it is known that the cases of diabetes 2 has increased to more than 20% in the last 10 years. Type 1 diabetes is usually diagnosed during childhood. However, some could be diagnosed even after the age of 20. The main causes is inadequate insulin production. The causes for most of them is not known, it's idiopathic. However, others could be associated with immune problems, genetic problem, and some viral infection. So diabetes type 2 is an adult type of diabetes, usually diagnosed after the age of 35. The main problem is insulin resistant plus inadequate insulin production. So another type of diabetes is gestational diabetes. This usually happens to women who are pregnant. Their blood sugar rises during pregnancy, but goes back to normal after delivery. But however, it is a risk factor to develop diabetes type 2 in their later life. When we talk about risk factor, it means those conditions which you know that if they are present in somebody, it enhances this person's chance of developing the disease compared to the rest of the population who do not have those conditions. And these are further divided into modifiable risk factor and then non-modifiable risk factor. Non-modifiable in a sense that they are not affected by lifestyles modifications, and then modifiable in a sense that they are affected by lifestyles modification. So the non-modifiable risk factor include the family history. Like in our family, if we have one of our parents, that is our mother or our father, or one of the siblings, which could be our brother or sister, has diabetes, then we have higher risk of developing diabetes compared to the rest of the population. So also ethnicity or race, like it is known that the African American, Asian American, as well as the Native American has higher risk of developing diabetes compared to the rest of the population. So also age is an important risk factor. So an adult that is more than 45 years of age has higher risk of developing diabetes compared to the younger population. Also, a woman who was previously diagnosed with gestational diabetes, or a woman who had given birth to a baby that is more than 4 kilograms weight, has a higher risk of developing diabetes than those who do not have this risk factor. So the modifiable risk factor, these are the most important one in as long as prevention is concerned. So this includes obesity as well as habitual physical inactivities. So here also we would like to talk about food amount as well as food choices. So because when one eats too much and does less activity, so it means you are using less of your energy, and therefore the reserve of this energy will be converted to fat and the person becomes obese. So also we talk about food choices because there are foods like those that contain high cholesterol level, like most of the palm oil that we have in the market has a lot of cholesterol, and also most of the butters that are in the market are also saturated fat. All these things are risk factors for diabetes. Diabetes has both long-term and short-term complications. Short-term complications are usually acute, seriously, and they are usually discovered and managed at the hospital. In conclusion, prevention is better than cure, and diabetes can be prevented by maintaining normal body weight as well as increasing exercise. Those that have the symptoms should rush to the nearest health post to ensure early diagnosis, treatment, and to prevent complication. Honor your health as the most precious gift.
man sama doom nido essentiel laa koy jox ndax fer ak vitamine C bi mu àndal muy lu am solo ci seen màggaay ak seen dundu bés bu ne rax ci dolli nido essentiel dafay tax ma gën a mën a yaxanal sama xaalis.
nido essentiel bu bees bi am na loolu vitamine C ak fer. nido essentiel baax na ci seen dundu doom baax na tamit ci njëg li.
This is indeed a joy to see how much these young doctors have learned at the university in the Gambia, and they are ready now to get qualified and to serve the nation. Once more, we all thank the President of the Gambia, President Jammeh, who actually enabled these young people to go to their own university, to learn at your own university, and to serve their own people in the Gambia.
Well, viewers, I hope that you have been following our discussion. Well, I'm afraid we'll take a short break. When we return, we will join Fatou Camara and Idris Benshuda. Don't go away.